Dear audience, let me introduce my PhD topic, which is the role of alternative treatment methods in lung cancer. My name is Shahar Adar. I am first-year PhD student and fifth-year medical student. My supervisor is Danish Balash Horvathi, and my SMS is Nina Galtitska. My vision is to increase the quality of life and the survival rate of patients with lung cancer, and my mission is to conduct a comprehensive analysis of different treatment methods in lung cancer. During my speech, I will mention two ongoing projects. Both of them investigate different loco-regional therapies for early-stage non-small cell lung cancer, and each one of them I will do using a different methodology. My first project, investigating the safety and the efficacy of loco-regional therapies in early-stage non-small cell lung cancer, and for this project, I will choose the methodology of systemic review and meta-analysis. So a bit of a background. Every year, there are 2.2 million new cases diagnosed with lung cancer. Out of them, 85% are diagnosed with non-small cell lung cancer. Nowadays, there are three main loco-regional approaches for the definitive treatment of the disease. We have surgical resection, lung ablation, and radiation therapy. Surgery is now the gold standard. And for those patients who cannot undergo surgery, we offer ablation therapy or radiation therapy as an alternative. There are a few disadvantages for surgery being a gold standard. So first of all, the longer hospitalization time and the longer rehabilitation time of patients undergoing surgery comparing to patients undergoing ablation therapy or radiation therapy is very high. So patients undergoing surgery will be in the hospital for a week, maybe for 10 days, whereas patients undergoing radiation therapy or ablative therapy will stay at the hospital for 24 hours observation. Additionally, the study shows that up to 24% of the patients that needs to undergo surgery refuse to receive treatment out of fear of complications and other personal reasons. That is the reason that we would like to investigate whether ablation therapy or radiation therapy are as safe and as effective as surgery. Our clinical question: can lung ablation or radiation therapy provide a viable alternative to surgical resection for the definitive treatment of early-stage non-small cell lung cancer? And we hypothesize that either ablative therapy or radiation therapy are non-inferior to surgery. And by investigating this topic, we could provide a better treatment personalization for the patient. So the patient will get the best treatment that they can have, either if it's surgery, ablation, or radiation. We conducted this search key, which has three domains. The first is our population. The second is surgery being as the current gold standard. And the third domain, which is the alternative, minimally invasive techniques, either ablation therapy or radiation therapy. We ran this search key in 3 databases, and overall, we found around 9,000 hits. And after duplicate removal, title abstract selection, and full text selection, we included 162 articles to our pool. To those 162 articles, we did citation chaser. And again, after duplicate removal, title abstract selection, and full text selection, we included an additional 10 articles. Now we are at the stage of data extraction. Me and my co-investigator are planning to finish this stage at around mid of April. My second project, investigating the safety and the efficacy of lung cryoablation therapy and surgical resection for patients with early-stage non-small cell lung cancer. And for this project, I will choose the methodology of randomized controlled trial. So as I was saying, surgery nowadays is the gold standard of the treatment of the disease. And due to its big disadvantages, the long hospitalization time and long rehabilitation time, around 15 years ago, there was a significant improvement in the ablation technique, which potentially provide an alternative and a safe option for patients for the definitive treatment of the disease. However, nowadays there are no randomized controlled trials that comparing surgery and ablation therapy for patients with lung cancer. And that's what we want to do. And I would like to say a few words of a specific technique, the lung cryoablation technique, in which we would investigate primarily. So during this procedure, the physician, by using a CT device, inserts a probe to the patient's chest. This probe will become very cold, so the physician will decrease the temperature of the probe to around minus 60 degrees. In the patient's chest, formation the so-called an ice ball. This cold temperature will result in shrinkage of the cells. All the enzymatic activity will be decreased. After that, the physician increases the temperature of the probe, resulting in a hypotonic environment. Water and fluids rush into the cells and forming in the explosion and destruction of the cell. We can see at picture A that we have a peripheral lung tumor, and in picture B, we can see the ice ball visible during the procedure under a CT device. Our clinical question is, can lung cryoablation provide a viable alternative to surgical resection for the definitive treatment of early stage non-small cell lung cancer? And we hypothesize that lung cryoablation is non-inferior to surgery. And again, by investigating this project, we could provide a better treatment personalization for the patient. So the patient will have the best treatment that we can provide, either ablation or surgery. I would like to summarize my two projects. So both of them are associated with the different treatment methods of early stage non-small cell lung cancer. The first project compare ablation therapy, radiation therapy, and surgical resection, whereas the second project specifically mentioning cryoablation and surgical resection. I would like to summarize my presentation with a quote of Patch Adams. You treat a disease, you win, you lose, but when you treat a person, I guarantee you'll win, no matter what the outcome. Thank you very much for your attention.
So I'll take the first question. Thank you for your presentation. I wanted to ask, are there any side effects with this cryoablation technique?
Well, thank you for your question. So yes, lung cryoablation has its pros and cons, as every procedure, of course. And one of the disadvantages of the cryoablation or any ablation technique is increased risk of pneumothorax, for example, and the limited ability to reach a more centrally located tumor. So the more central the tumor is, and the larger the tumor, the less effective the ablation or radiation techniques compared to the surgery, of course. So this is the disadvantages.
Thank you.
Thank you so much for your presentation, Shahar. I was wondering regarding your second project, if there are any ethical considerations that you can mention?
Yes, thank you for your question. This is a really good point because what Sevna was mentioning, and this is true, that we would like to compare two different treatment methods for the same population. So how do we know if one of them is better than the other? And to answer that, I will mention that, first of all, there are different retrospective studies that compare and can confirm that there is an equivalent or a non-inferiority outcome for ablation and for surgery. This is one thing. And additionally, there is an ongoing meta-analysis that hopefully will be published at the end of the year, which can also help us potentially to conduct the second project. So we also based on that.
Congratulations on your project. You mentioned that these are treatments for early stage lung cancer. How do you define early stage?
Thank you for your question. So we would like to define an early stage lung cancer. So we will use the TNM classification, both the 8th and the 7th edition. So it will be either stage 1 or stage 2, without lymph node involvement and without any metastasis. And the tumor we would include tumors that are smaller than 5 centimeters.
As you might know, this type of cancer are very rarely found in this stage. So the majority of lung cancer is found when they are more advanced. So are you planning to look for this ablation from a palliative point of view, or does it work for patients with an advanced form of lung cancer?
So thank you for the question. What you're asking is very true. So the amount or the percentage of patients that are diagnosed with an early stage compared to those patients who are diagnosed with an advanced stage and inoperable is about 20%. So 20% of the patient is diagnosed with early stage, and unfortunately the rest are diagnosed with a later metastasized and advanced stage, which are not relevant for us. For this study, I mean. Regarding the palliative treatment, those adjuvant and neoadjuvant treatment are offered to the patient with a more advanced stage. So neoadjuvant treatment is used to decrease the size of the tumor and make the patient more prepared for the definitive treatment. And the adjuvant treatment will be given to patients with a larger tumor to prevent a furthermore recurrence. So those population will not be included in our study. We focus on small, solid, singular tumor.
Thank you. And the last one?
Thank you for your presentation. I'm just curious that after the full text selection, you have a better vision of your outcomes. Do you know what outcomes you would like to include?
Thank you for your question. So we started the data extraction process, and so far we see that the overall survival, the cancer-specific survival, and the progression-free survival is our main outcome. However, there are an additional outcome that we would like to investigate as well, such as the radiation toxicity, the occurrence of pneumothorax, and other complications related with the different techniques.
Thank you.